Yep, go ahead.
Like Dr. Rankin said, my name is Kathryn Gelately. Some may know me already. I've helped out in the nursing department before and done my practicum here. And I'm going to do a presentation on caring for diverse cultures. Because we all know that as a nurse, we are going to be meeting with diverse cultures. Our country is becoming more and more diverse every day. So, you know, as early as 1893, we go back to community nursing. And, whoops. Why is it doing that? With that. Okay. Lillian Wald is a very important person to know about in community public health. She was the founder of Visiting Nurse Service in New York City, and it's still going strong today. She was a nurse, a social worker, a women's rights activist, and she founded the Henry Street Settlement. What's interesting about Lillian Wald was that she was wealthy. She came from a good family, had good education, but you know, she was in nursing school, and then she decided she was going to try medical school. She was working in a hospital, but one day a child came to her with a sick mother, and she went out to the tenements of New York City, and the child took her to the mom, and she saw the living conditions that this poor family was had to live in. These were in high-rise apartments. This was during the industrial age, where there wasn't labor laws. There was no pollution control. These people lived in dire conditions. So she went to care for this sick mother, and it opened her eyes to this whole reality that she wasn't aware of. And she thought, if I could let other people know about the living conditions and what is needed for this community, then other people will help and we can make a change. So she was very, very influential. She founded public health. She was a founder of public health. And she cared for immigrants in the community. So she would go into their homes and she would take care of them. And you know, like I said earlier, nursing, we've been caring for diverse cultures, and every day you see it on the news. You know, we're getting more immigrants, we're getting people that are seeking asylum. So it's just a very important thing that nurses have to deal with.
Isn't that one?
Let's see.
See, it's not just
Okay, so you should be able to click it as you go.
You used to be my favorite student, no longer.
Let me make sure it's okay.
It's about the first to the second.
Yeah, but I won't. Here's my picture.
That used to be your favorite.
Yeah.
Well,
All right, fine. Okay.
Sorry about that.
Right. Okay, thank you.
It's because I don't have any favorites. I love you all just like I am.
So sorry about that, but this is Lillian Wald, and this is her friend Mary Brewster, and they're the ones that worked in the Henry Street Settlement. And another thing that's so interesting about her is that she actually went there and lived in the community. She didn't live in her nice home. She went and lived in the tenements with the community and got to know them and knew their beliefs and their value systems. And that's a really important thing. This is an interesting picture. This is actually from the New York Visiting Service. They have a history, and they have this picture of a tenement. This is what it looked like. The children around on the scaffolding. You know, they had multiple families in one living area, one room. And as the Henry Street Settlement started to expand, they were providing care to these people, examining newborns, teaching them, and doing bedside care. This is another neat picture. They actually go into the home sterilizing the milk, showing how to prepare the bottles for babies. And this is the most interesting thing. They actually did roof hopping because these buildings, these high rises, were so close together. the nurses, as they started to expand in the Henry Street settlement, they would actually get on the top of the roofs and hop from roof to roof to get to the next apartment because they didn't have elevators. You know, you'd have to go up these high-rise buildings to all of these different apartments they were visiting, so they would hop from roof to roof. So I thought that was kind of neat. And like I said, you know, today we face a greater diversity, and in order to understand the culture, you have to be with the culture. You have to respect their values and their beliefs. So what is culture? Anybody care to define it? Get a stab at it? What culture is?
Why me?
That's okay, you don't have to. Go ahead.
Is it like a set of like standards, norms within like a certain group of, individuals, races and things?
Yes, you're on the right track, absolutely. So it's a set of common beliefs, values, and assumptions about life. It pervades every aspect of our life, religion, language, food. So, you know, it refers to everything. I mean, it could be your age, your gender, your sexual orientation, whether or not you're disabled, your profession, where you live. So culture, you know, is everything about us. It makes up who we are. And keep in mind, race and culture are not the same thing. Race is more your physical characteristics, your genetics, whereas culture, you could be of one race but have many cultures, right? You know, I am white, but I also am Irish and Welsh and Scottish, and I relate to those different heritage, and they all bring a different custom or belief to it. And we've all heard of the melting pot. The United States is the melting pot, which was, you know, especially back in Lillian Wald's time when immigration was high, people wanted to assimilate into the American culture. They didn't want to be known as being from somewhere else. They would try to look like us, speak like us, change their names. But nowadays, we like to think of it as a salad bowl, where you still maintain your culture, your beliefs, and you celebrate the diversity and as individual. This is just an example of a culture, Chinese culture, different things that they do. Tea, which I didn't know, was also a symbol of social status. So depending on what type of tea or how you pour the tea determines your social status. The Chinese are very family-centered, especially with the young children. They're focused on the young children in the family. And fortune cookies have anything to do with Chinese. They don't use them, they don't make them. Grandparents live with their children, and their health, the core idea of Chinese medicine is the qi. It's the balance of the qi. Is it high or is it low? It's the energy in your body. This is another example, Indian culture. It's the birthplace of Hinduism and Buddhism. They use a lot of herbs and spices in their food. They have a patriarchal family, arranged marriages. They believe in Ayurveda, among other health forms, but it's the science of long life. It's also a balance. They're trying to have a balance in their life. It's all non-invasive. So when we talk about culture, then we have to think about cultural competency. Does anybody want to tell me what they think cultural competency is?
Just kind of, being aware and having knowledge of all these different cultures. If you have a patient that's a specific culture, knowing the basis for what type of care you need to give that person.
Yeah, excellent. Yes, that's definitely what it is. And it's so important for nursing. I'm sure if you're going out to clinicals, you're experiencing that because you're getting to know different people, different beliefs, different customs, and you don't want to offend them because you have to develop a relationship and trust with them. And if you don't have that, you can't really do your job as well. So we answered that question. So also, cultural competence has a lot of definitions. It's a broad blanket term. Just depending on who is defining it, you're going to get a different definition. If a business organization is defining it, they're going to have a different definition than whether a nursing or a doctor is going to, what their definition will be. So So this is just a definition of cultural competency from the American Association of College of Nurses. It's the attitude, knowledge, and skills necessary for providing quality care to diverse populations. And another one is from Brunel, and it's developing awareness of one's existence, demonstrating knowledge, understanding, accepting and respecting cultural differences, and adapting to care. So we have to remember that each individual should be viewed as an individual with unique human differences. And we always have to keep that in mind. And then cultural competence is dynamic. It's always changing. You're always learning. So it's constant. So why is cultural competency important? Well, we have standards of practice. We all know that as nursing students. Everybody has standards that are addressed through legislation, policy, and guidelines. And these are just a few of the organizations that tell you that cultural competency is important and that it's necessary for nurses to provide the highest quality of care. They have to be culturally competent and aware. So nursing must provide culturally competent care by understanding the values, preventing any misunderstandings. We all know that if you can't speak the same language, there's going to be communication problems. There's prejudice, there's stereotypes, there's biases. When you think of certain cultures, certain things pop into your head, and it's not necessarily true. Just like the fortune cookie. Everybody thinks it's Chinese. Well, no, it's not Chinese. So if you have a misunderstanding, then you're not going to be able to adequately communicate with your patient. So these are other reasons why. We all know these things that are going on today. We're an increase in globalization and diversity, global conflicts and displacement of populations, evidence of health inequities, and lack of diversity in our own health profession and other health professions. So globalization, we have an increase. By 2055, the United States will have no racial ethnic majority group. So you can see the white population is decreasing and Asian, Hispanic, Black, they're increasing. And every day we're seeing immigration, people coming into the country. You know, it's way more diverse. Displaced populations. Anybody know what that is? What's a displaced population? Well, we have, like we've talked about, we have conflicts. People are being forcibly displaced from their countries. They have no country. They come here because of war and famine. And they're coming into our country and they need help. They have special health needs that need to be met. Mental health illness, I'm sure, because of all the things that they've experienced. So, you know, we're on the front line of nursing to care for these people. Inequities and disparities. So before we talk about inequities and disparities, we have to understand what causes it, and those are social determinants of health. And they're responsible for inequities and disparities. And they're conditions that people are born into. They have no choice. It's either they're born into a poor family or they're born into a wealthy family. You know, it depends on where you live. All these things can determine what's available to you, what resources you may have. And they have a negative impact on populations, and they have more disadvantages. And these are just a number of all the health disparities. You could have a health disparity because of your race, your gender, your employment. You know, it just goes down the line. And research shows that minority and racial and ethnic groups, they're the ones that are disproportionately more likely to develop, you know, health conditions. They're going to have poorer health conditions, poorer treatment, and poorer outcomes. That's just an interesting fact of the United States. So the United States is a member of the Organization of Economic Cooperation and Development, otherwise known as the OECD. And there's 36 countries that are in this group. And they do studies. And they, you know, of course, United States is the only one of 36 that does not provide universal health care. So what does that show for disparity? Where's the equity? Because if you're poor, if you don't have a job, how are you going to get insurance and proper care? And they outspend all other members on health care. So the OECD is concerning me, a study of unmet care due to cost. And 43% of low-income adults reported having unmet care needs because of the cost. Oops, too far. So this is just the unmet care, and if you could see the red line in the middle, that's the OECD average, and then look where United States is, it's all in the end, 43%. So you can see the other countries and look at the cost rate for the United States. Also, skip doctor's appointments. 22.3% of the United States population will skip appointments because they cannot afford it. They would, you know, they have to eat. They have to work. You know, they have other priorities, and if the doctor's appointment's too much, then, you know, they have to skip it. And this is just another graph showing you skip visits. And you can see the red is the average for the OECD, and look where the United States is. And the United States shouldn't be there. So lack of diversity in nursing. That's another issue that we're dealing with. So 83% of all registered nurses are white, non-Hispanic, and of European American heritage. So what does that say to the patient when you walk into their home or if you're in the hospital and all there is, you know, white nurses? Wouldn't it be nice to have somebody that is, you know, Chinese or Mexican descent or African American that they can relate to and feel comfortable with and can share their values and their traditions and have a better understanding of it? So that's something that's really important for nursing, is to work on that diversity and encourage that. I like this picture because it's the perspective of everybody, of different race, different culture, and you know, it's so important to understand that we all look through our own eyes, our own cultural lens, and we have a different perspective, we have a different worldview. And I challenge each and every one of you to look through another person's cultural lens and not just your own, because you're going to learn about them and you're going to you know, develop more of a relationship, an ongoing relationship with them. And we all know the golden rule, but I kind of changed it up to say, do unto others how others wish to be treated, not how you wish to be treated. Because how you wish to be treated is going to be different than how somebody else is going to be treated, okay? So that's always a good thing to go by. And that's it.
Does anybody have any questions?
This is kind of pertaining to like your, like, do you think community nursing is like your specialty, like what you're most interested in teaching?
Yes. Yeah, that's my background, is in community health. And I was a public health nurse for 6 years. And so the majority of that has been in, you know, going out to people's homes. And when you go out to somebody's home, it's a whole different thing than when you're in the hospital. People aren't the same when they're in the hospital versus in the home. So you get to learn more about them. You get to see their family. You get to see how they interact with their family. And, you know, so that's always been a passion of mine, and yes, so that's definitely my background. Now, are you all nursing students?
All right, guys, thank you so much for coming. Okay.